From now on, we will be conducting a panel session with the 4 speakers representing Korea. First, I would like to give a special thanks to our 4 presenters. I will be first asking questions individually to our speakers and then receiving their answers, and then ask questions collectively to the group and receive collective answers. If presenters also have any questions for each other, that is also possible. We will now start with the panel session. My first question is for Professor Bom-Jun Lee. The patients that received telemedicine at the Korean Medicine Center displayed various symptoms, and although most were treated with the generalized prescription of 청패 배독탕, they also showed fatigue and sequelae. Do you have any recommendations regarding what types of herbal medicines that the physicians that use herbal medicine could use globally, and how long should they use them? So we treated many patients and also observed the sequelae symptoms. However, we do not have one fit-for-all prescription that fits all symptoms. For each symptom, as you all already know, traditional medicine or Korean medicine individually assesses each patient. So each patient should be individually assessed. For example, in fatigue, although it could be due to a lowered immune system or stamina because of the infection, as Professor Chan Young-kwon explained earlier, it could also be a secondary symptom due to depression. Therefore, we need to take on a multifaceted approach and prescribe individually according to individual symptoms. As I explained in my talk earlier, in our evaluation of symptoms, in severe cases after infection, the interstitial area is where the lung is compromised. And so symptoms are different from bacterial pneumonia. Symptoms of sputum were not accompanied, and the general symptoms that were seen were dry cough. Dry cough was very prevalent, and in Korean medicine, dry cough correlates to weakness of lung, 폐위증. So the symptoms seen in this present infection were generally dry eye, dry cough, and dyspnea. So many cases developed into what we commonly refer to as lack of yin in the lungs, and so it could be considered to be a key point to use herbal medicine to treat these kind of symptoms and recover to health. Next, I have a question for Professor In Soo-jang. You told us about how the Korean Telemedicine Center generally managed and treated mild patients and patients in the recovery phase for management of sequelae. Due to explosive increase of patients, those who could not be accommodated by medical care were selectively isolated. And the current situation in Korea also shows the number of patients is in the rise again. And there are also press releases regarding how treatment is currently being considered in the self-isolation state. In the current situation, how do you think that we should conduct monitoring by phone, and what types of treatments should be provided to what type of meaning? First, I would like to state that the Korean Telemedicine Center that was conducted in the first half of this year has significant meaning and also holds great potential for the future, although this was a first effort for us. The greatest reason why this model holds significance is that the environmental situations are continuously changing, and also the national situations differ by each country and continue to change. As each of the conditions for each nation differ, I believe that this model will be a good fit for one of these nations. As mentioned earlier, 80% of cases that we treated were mild, and although the rates differ slightly by country, primary care physicians take about 30% of each country's national care system. We always see on television screening centers with personnel treating patients wearing level D personal protective equipment. This type of treatment cannot accommodate all patients or cover the explosive increase. So in the end, we would have to resort to the type of model that we proposed, using remote medicine treatment and using primary care physicians in care of patients. And I believe that use of more Korean medicine doctors and Korean medicine with close provision is the most appropriate model and answer to our needs. I believe that this would lead to a more synergistic effect through more detailed and close care. I would like to give a question to Professor Chan Yong-kwon. In diseases requiring self-isolation, of course, isolation is not required due to mental health. However, the area of mental health in this area is receiving more attention. How much and to what extent do you expect that remote medicine treatment will have effect, and that using video conference systems? In the area of mental health treatment, telemedicine has been receiving attention since earlier. And so many studies have already been published. As a representative study, a study published in 2013 in the American Journal of Psychiatry reports how in a primary care situation, in a population of depressive patients, the patients were divided into two groups, with one group receiving face-to-face consultations and one group receiving telemedicine. The patients were followed up for 18 months, and interestingly, the group that received telemedicine showed better treatment rates and remission rates. In the discussion, the authors attributed these results to how in telemedicine, active participation of the patient is available. And more recently, AHRQ, in 2019, it publishes comparative effectiveness review series regularly. In 2019, data was comprehensively collected regarding telemedicine use for various symptoms and various pathologies and diseases. These results also show that telemedicine is effective and comparable to face-to-face in-person consultation. However, one problem is that the service discrepancy is very large. What I mean by in referring to service here is, although it also refers to the contents of treatment, it also refers to the technology used. These results in the case of our center, the mental health resources that are provided at our center are somewhat restricted. It cannot be considered to be an intensive mental health care. Therefore, I believe that our center needs to make more investments, and we especially would need a specialized designated team of personnel that can provide intensive care. Even if the number of personnel is not that large, and that team of designated personnel could provide bidirectional treatment to our patients for better outcomes in our patients. Next, I have a question for Director Eun-kyung Lee. I think you held a very pivotal role in operating the Telemedicine Korean Medicine Center at the Association of Korean Medicine, managing it and also collecting data and then sending the data to the professors to write a very high-quality data study. Do you have any comments for us regarding what difficulties you faced in operating the Telemedicine Center and also in collecting data? Including the inherent limitations as a non-face-to-face consultation. The bulk of outcomes and data are collected and come from the hospitals. However, our situation could be likened to that of Korean medicine clinics, with Korean medicine doctors providing individual treatments. And to the aim of standardization, I provided a guide, and based on this guide, we provided education and training. And then we also attempted to standardize the reports in recording symptoms so that the same records would be used in writing up medical reports. However, because the Korean medicine doctors had to continue seeing patients and in calling the patients, some of these calls would last up to 30 minutes. So leaving detailed medical records was a challenge. There's also the issue of difference in treatment quality. So the lack of standardization is an inherent limitation that is seen in primary care clinic situations. And also regarding telemedicine in non-face-to-face consultations, there is the issue of quality. And we stress the importance of using devices in increasing the quality of telemedicine care and also in collecting data. So using not only audio devices but also video devices where we can assess the patient situation more comprehensively, and also use of various evaluation tools such as testing devices. and technology. However, the fact that we were only able to use audio in calls is a large limitation. So in summary, we could say that the standardization issue, the rate of medical record taking in assessment, more use of various devices, and the lack of utilization of various devices and technology were problematic. Today's news release also reports increase in the number of patients in Korea and how these patients cannot be accommodated medically due to their increase. And so it is being proposed that these patients that cannot be covered have no choice but to go into self-isolation. We still receive calls from at least 1 to 2 patients every day, and we are currently worrying that there may be a second break. The center was not operated to the objective of research, and so there were limitations in setting a good data collection system with regards for research. And there is also the main and major limitation of not being able to receive governmental support. And so it would be preferable if we would be able to collect higher quality data through more systematic data setting. The next question is a collective question for everyone, so anyone can answer. Currently, we do not have any treatments or vaccines, and so the only method that we can use is self-disinfection and social distancing. So these methods all refer to cutting off contact from the source. However, under the current medical system, what alternatives do we have? In intake of herbal medicine tonics and through studies that study the mechanism of action regarding these tonics, it has been shown that activation of IgH and IgM are involved. What kind of role do you think that traditional medicine could take in diagnosing and treating diseases, and also treating the fundamental reasons of disease and the symptoms, and also in treating patients with underlying diseases? I would like to be the first to answer. Regarding the virus is a novel type that we have never seen before. Regarding how it was introduced to our country and cutting off all contact, and in development of the vaccine, there is a certain period of absence. I think it would be optimal that if we were able to use herbal medicine during this period of absence in this whole progression of events. However, it would be problematic if we used herbal medicines empirically and not based on scientific confirmation. And this is not acceptable from the perspective of public health. At this point of time, I believe that we should do is accumulate more data through the various treatments that we provided. The COVID-19 virus enters the body through the ACE2 receptor. And although they are not studies conducted in Korea, there are many studies that have been conducted overseas on bench science regarding how this process was inhibited with use of herbs. In this case, we would be able to make various recommendations based on the research of various herbs. However, in this situation, we would have to prescribe herbal medicine just based on pattern differentiation, and from the perspective of public health, this is not acceptable. Therefore, in this situation, it is imperative that we increase the capacity for research. Regarding your question on how much effect intake of tonics would have, of course, it is very hard and difficult to evaluate the amount of effect. Upon infection with the virus, of course, our defense system, by means of IgM and IgE, activates. There is considerable individual difference in the immune system. So even in exposure to the same virus, some individuals show mild symptoms while some show severe symptoms. And this difference is attributed to individual immune response differences. There will also be an individual difference in the threshold required for production of antibodies upon vaccine administration. In this type of situation, it is very difficult to quantify the results and outcomes. However, from a Korean medicine evaluation standpoint, there is definitely a higher correlation with the individuals with deficiency syndrome. So as we were talking about earlier, immune boosting would occur, and vaccination with the same vaccine may result in higher thresholds for antibody production. Even in equal exposure to the virus, if your immune defense is stronger, perhaps we can generate these kinds of personal differences through use of herbal medicine. We'll have to keep thinking about and contemplating how we're going to confirm and verify these results, but I'm sure there's sufficient potential for this. I'd like to add a little bit more explanation to that, as there may be viewers from non-medical backgrounds also. Advertisements these days advertise a lot of food products that claim to enhance immunity. However, viruses hold a key to entering the body. Regardless of whether our body's immune system is strong or weak, they open our body with the key and enter. So the only possible way to prevent infection is, as mentioned earlier, personal disinfection and social distancing. But once the viruses enter our bodies, it's a matter of immunity and resistance of the individual. Also, the defense systems, including immunoglobulins that we talked about earlier, are involved. We don't have a large body of evidence as of yet, but we're in the process of amassing evidence. So wouldn't herbal medicine be able to contribute to enhancing such resistance to a certain degree? And then personal exercise, lifestyle management, care and management of underlying diseases, these are factors of importance. So I personally am very positive regarding the potential areas where we can use medicine, herbal medicine, to enhance our immune system. I would also like to add a comment, although not my specialty area, from the perspective of preventative medicine. While non-contraction of the coronavirus is of course an important precaution and preventative means, I think it also is an important preventive strategy to prevent transition to severity after infection with the virus. According to previous epidemiological surveys, patients with cancer, diabetes, chronic lung disease, heart disease, and kidney disease, the vulnerability of these individuals is a focus of attention. Especially obesity is commonly treated using Korean medicine, so why do obese patients transition to severe cases when infected with the novel coronavirus? Its mechanisms are proposed to be due to greater fat amount in lung fat, resulting in poor lung function. Also increase in overall inflammatory cytokine levels, and there are few cytokines such as adiponectin that protect lung tissue. These mechanisms are being presented. Even if it's not necessarily related to the COVID-19 coronavirus, these mechanisms have already been investigated previously in herbal medicine studies on obesity. As mentioned earlier, it can reduce adipogenesis or increase adiponectin levels or reduce the level of inflammation. There are many such studies. There are also such components as curcumin, berberin, and ginsenoside. If we could discover the underlying connection, we could perhaps conduct a retrospective analysis. For example, of obese patients in Korea, some of them will have received herbal medicine and others will have not, so we could investigate whether there's a difference in the percentage of confirmed coronavirus cases that become serious. Of course, we would need to prove this through further evidence, but I am optimistic with regards to herbal medicine playing a substantial role in that regard. Thank you, your answers were all very rich in content. Okay, then I'll give you the last question. It has been about a year since the first case occurrence of COVID-19. Each of the 4 presenters have created a guide for Korean medicine treatment of COVID-19, collected statistical data, and managed the telecenter. We also have respiratory disorder and neuropsychiatry specialty professors collectively coming from many different fields. Could you give us a recollection of thoughts regarding your experience with COVID-19, also your thoughts on what the future holds? What future prospects? And on a different note, the Association of Korean Medicine, which could be viewed as the civilian private sector, took on the responsibility of running the Telemedicine Center. The government is not actively utilizing Korean medicine or traditional medicine. Do you have any suggestions or messages for the various related sectors? Or if you have any questions for each other, please ask them freely. We will go around the table. Shall we start with Director Eun-kyung Lee then, please? Yes, well, in a way, I started at the center. Even now, the Telemedicine Center operates, and we're working on the 2020 COVID-19 white paper. We're going to have a publication press release next week. So in the process, I felt like this year was spent mainly dealing with COVID-19 by the association and by myself. Looking back, there is a lot of regret and more to be desired. My largest regret is that compared to the SARS and MERS and swine flu situations, KMDs came forward to take on an active role in responding to the pandemic. We opened a telemedicine center, and other than that, we also put in a lot of effort to expand the involvement of KMDs in COVID-19, including disinfection, management of public health, and epidemiological investigations of confirmed cases. However, due to Korea's specific circumstances and various issues, this did not come into realization well, so my biggest regret is that the process depended mainly on personal sacrifice and service at the private sector level. It's political and something has to be done on a larger scale. We continue to monitor cases in China. When considering what role traditional medicine could play in COVID-19, which was the topic of our debate earlier, vaccines fall into the area of preventative medicine. Development of a cure or prevention of aggravation of symptoms and treatment of symptoms could be considered to be the medical therapeutic response. And there are roles that traditional medicine plays in each of these fields, especially regarding control of symptoms upon detection, treatment of coughs, fever, pain, and the antiviral effects of herbs or herbal medicine, and various immune system stimulation effects. The next area that we have been focusing on is the sequelae, to improve the physical strength of those who suffer from sequelae or in treating remaining symptoms. I consider this role to be the therapeutic role of traditional medicine, of which the verification process is underway in China. Also, in the current situation where we have lack of medical personnel, as KMDs are similarly trained and educated as physicians, their participation in public hygiene management and disinfection should be increased. The challenges that face us are not expected to resolve anytime soon, as no one expects COVID-19 to end with the end of this year. In fact, even without COVID, many predict that novel infectious diseases are something that mankind has to live with. I also do not expect COVID-19 to end with this year, and that it may come back in a different form, and for that, the medical community and the government should respond with preparatory provisions. Regarding the matter of how to utilize the Korean medicine community and Korean medicine better, I think consideration is required at a government level and among healthcare professionals, going beyond the Korean medicine community. There, consideration of the therapeutic effects of Korean medicine would also be included. Also, the issues of use of Korean medicine doctors may be discussed more in depth. That is the end of my answer. Do you have any comments for us, Professor Bom-jun Lee? Perhaps I think like this because I am affiliated with a college. But if we are to become more involved in public health, we need to strengthen the body of evidence. Frankly speaking, we don't even have any level 3 labs where we could conduct direct research on the effects of herbal medicine on the virus. So in lack of basic investments and funding, we can't participate in public health just because we think we should. In this situation, 청패배독탕 was also introduced from China. Our neighboring country, China, is investing in and revigorating Chinese medicine, and as we are a relatively small country of fewer inhabitants, it would be preferable if we could connect and link such efforts internationally, and also invest in facilities that could support such international scientific interactions. We would require an evidence basis for us to contribute meaningfully to public health, and we need to come up with a long-term plan. Also, as antigens continue to mutate, in SARS, MERS, and COVID-19, we saw mutation with the continued spread of infection. And as the next infectious outbreak is definitely coming, we should prepare for it. Telemedicine will be reoperated then, and clinical duty schedules need to be planned more systematically, and we need to register the results in a registry so that the data can be shared globally. We need to build a well-organized system. Could I also ask for a comment from Professor Chan Young-kwon too? Yes, I would like to give you my personal impression mainly. Although I already did treat mental health patients, only after the COVID pandemic occurred did I realize how many individuals are susceptible to mental health disorders. This led to a lot of self-reflection on my part also. I'm sure many of the general public and public are watching this video, so I would like to send a message that I hope you pay more attention and interest to the people around you vulnerable to mental health disorders. Also, personally, I'm working on a project to develop a smartphone application for psychiatric use. In working with the project and planning the application, I realized that I'm still young and a person of today, and the technologies that come so easily to me are not so to the elderly or the cognitively impaired. These technologies may be very difficult to access and be uncomfortable for these populations. So even in the technological area, we should be more mindful and supportive of vulnerable social populations who are unable to benefit from such technologies. Yes, I would like to thank our speakers for their presentations and great comments in the panel discussion. Also, for our viewers who are watching online, we will provide our email address in the subtitles. Then, if you give us your questions and comments through the email, we will do our best to provide answers. We will employ the same method for our overseas session speakers. And although unfortunately we could not conduct a joint panel session due to the time differences, if we have any mutual questions, we will pass them on and receive the answers and contemplate the method through which to pass on and share the Q's and A's. Thank you all for joining us today in this informative discussion. Thank you.